Hello, I'm Buse, a member of the Board of Directors of the American Headache Society, a licensed psychologist with a focus on migraine and other chronic illnesses, and a clinical professor of neurology at Albert Einstein College of Medicine. And I'm going to be talking about women with chronic diseases, specifically migraine and other severe headache, during the pandemic, both the challenges and the opportunities. Migraine is a severe, potentially debilitating, and quite common disease. In fact, it affects a good percentage of the population. Over 1 billion people live with migraine around the globe, about 40 million Americans, and about 2/3 of them are women. So about 30 million American women live with migraine. It's most common during midlife, so about the 20s, the 30s, the 40s, the ages when women are getting education, starting their careers, forming families, maybe having children. Also the ages in the 40s and 50s when women are also caring for aging parents and their community. So migraine is most common, most prevalent, most debilitating at a time of life when the most is expected of women. What is migraine? Migraine is more than just a headache. It is a complex neurologic disease made up of migraine attacks. A migraine attack does typically include the severe headache pain that everyone would expect, but it also comes with other features that can also be terribly debilitating, like extreme sensitivity to light, to sounds, to odors. Now, at first, you may not think that's debilitating, but it means that it's uncomfortable to go outside, or maybe someone needs to wear specific therapeutic glasses or sunglasses or a hat. It means they have to avoid certain places. It means that someone might be most comfortable in a dark, quiet room away from their work, their social life, and their family. It also has other features like potentially nausea, vomiting, as well as other pain features. When a migraine attack happens, it can last between 4 and 72 hours if untreated, up to 3 days of all of these features. Plus, there's typically a phase that comes before, called the prodrome, which can be up to a day of other uncomfortable and debilitating features, and the postdrome, which can also last another day after the pain ends. So a migraine attack in itself, just one, can be very debilitating. People who live with migraine may have many migraine attacks per month. Some people even have migraine most days. Some people have migraine every day. And of course, that can take a big toll on all aspects of life: work, personal, school, family, social relationships, all aspects of life. In fact, in one of our research studies, 10% of women with chronic migraine, and that's headache on 15 or more days per month, said they either chose not to have children, had fewer children, or delayed having children because they were worried about being a good mother or how migraine would affect their children, either directly, passing it on to them, or indirectly, their ability to be a parent. Migraine is costly to society, with millions and billions of dollars in both direct care, costs for medications, treatments, emergency department care, and indirect costs, all of that missed work, those early retirements, not going for that promotion, a lot of missed indirect costs with migraine. But really, migraine hits right at the heart. It steals people's lives. It steals their career plans, their family plans. It steals away big moments like weddings and vacations and graduations, and it steals away small moments, those everyday moments with children, with friends and family, those everyday little things that you want to be able to do. You never know when a migraine attack might happen, and when one is happening, how much you can do. Migraine is actually the most disabling disease on the planet, according to the World Health Organization, among people aged 15 to 49. And among all ages, it's the second most disabling disease on the planet, second only to back pain. As I mentioned, migraine affects everyone. Migraine affects the person with migraine, especially thinking about women living with migraine. It also is going to affect their spouses. We know from research that their spouses or their partners have effects on their work, needing to maybe call out or come in late to help their partner with migraine, maybe not being able to take that promotion or extra work assignment or traveling job. It affects their children. It affects their parents. employers, coworkers, friends, communities, neighborhoods, families, teams and organizations, employers and society. Migraine affects all of us. And when we're thinking about women in migraine, again, women who care for others, who hold such important jobs in our society, both in the workforce as well as caregivers, as friends, as sisters, as wives, as mothers, as parents, when that woman is affected, the ripples come out to all of society, and all of society is affected. So let's think about this pandemic that we're all in right now. It's 2020. We are in the midst of literally the worst global pandemic of my lifetime, and probably most people's lifetimes who are watching this right now. And COVID-19 actually can have severe effects on people with migraine, both directly. For example, there are headache and neurologic effects of the virus, and indirectly. So certainly the virus has created all sorts of effects on people's finances, their jobs, the fact that a lot of children are not in school right now and are home. So we have childcare issues, virtual schooling. We have increases in anxiety and depression. Anxiety and depression are comorbidities with migraine, meaning they occur at rates higher than chance. It's not necessarily that migraine causes the anxiety depression or the anxiety depression causes the migraine. It may be that there's shared underlying neurotransmitters. All three of these conditions use the same neurotransmitters in our brain. So if you have migraine, you're 3 to 5 times more likely to also experience depression and or anxiety. Well, living through a global pandemic has certainly increased that anxiety, that depression. We have social isolation. We've had disruption to medical care. Some sorts of care, if you can't get into the hospital or into your doctor's office, you may not be able to get things like trigger point, nerve blocks, or botulinum toxin A, which is Botox, which is a preventive injection treatment for chronic migraine. And in addition to living through this health pandemic, we're also living through ongoing racial pandemics, which have plagued our country for more than 300 years. We've had 300 years of inequities, of violence towards people of color, specifically Black people, and inequities of healthcare. And COVID-19 has hit people of color harder than any other group for a variety of reasons. Medical, social, health, access, finance, all of the above, you put them together, and people of color have been very hard hit. They've had the virus at higher rates than other people, and they've had worse outcomes for prognosis. So when we add the pandemic, the health consequences, the racial violence that continues, the life of living with migraine, we have multiple layers of severe stressors right now that are 30 million American women living with migraine are experiencing, and the subset of those who are people of color, Black people, Latinx people, people of other races and ethnicities, people of other religions, people who are underrepresented and underserved are experiencing potentially extreme distress right now. And as I mentioned, there are both these indirect effects of the pandemic as far as what it does to our finances, our well-being, our emotional. And we're seeing that people are having problems with sleep, with lack of exercise, with weight gain, with social isolation, all of those things that as we struggle through this really challenging time, our bodies do to cope. And all of those things are hard on your nervous system. So when you live with migraine, keeping your nervous system healthy and happy is very helpful. And that includes things like lots of regular sleep and managing stress and exercising and eating well. Well, those things are pretty hard right now. So it's all working kind of against the well-being of people with migraine. And that's why it's really important right now to really put as much emphasis as you can on getting good sleep, on managing stress, on making the social connections, if they're important to you, in a way that's safe, where you can, when you can. How can we support women with migraine during this incredibly difficult time? Well, what are some things that our government can do to help support us? What are some things that the agencies in power can do? One thing that's gone quite well has been telehealth. The quick pivot to telehealth has been quite helpful for people with migraine. In fact, that's been something that has been capable for decades, yet not widely used. But the pandemic really created the need for it. And as we saw everyone pivot and open up these options, this was very, very nice because you don't have to spend, of course, the extra time to get ready, to go out of the house, to drive somewhere to get your childcare. And frankly, someone who might be in a migraine attack or just pre or post migraine attack really may not feel well enough to get out, up and out dressed, and actually may not even be safe enough to drive, considering the sensitivity to light and problems with vision if they're still dizzy, nauseous, vertigo. Telehealth has really been a very positive thing for many, many health communities, including people with migraine. And we did see health insurances temporarily lifting some of the usual restrictions, like quantity limits of monthly triptans, for example, or adding more mailed service options for prescriptions, which was helpful. We also hear people with migraine telling us in large numbers that the ability to work from home, if they have a job, if they're already working, and of course, not everyone with migraine is able to work or able to maintain employment due to the extreme debilitating disability that's part of migraine. But for those who are, if they were able to work from home, it's actually decreased some of the pressure and stress. You don't have to get up necessarily at the same time. You don't have the commuting, you don't have the same time restrictions. So it created a little bit more freedom and a little bit more flexibility for someone to take care of herself and keep her job. And we would love to support as many people with migraine working to the degree and ability that they can and they want to by these measures, like the ability to telecommute. And one of the other amazing things that's come out of this very dark time is that the headache and migraine advocacy world has really gathered together as much as they always do, and even more, to support people living with migraine and to promote positive change. And some of the groups who are doing so much during this time include the Headache and Migraine Policy Forum, Miles for Migraine, CHAMP, which is the Coalition for Headache and Migraine Patients, the American Headache Society, the National Headache Foundation, and the American Migraine Foundation. They've all had online free educational advocacy and support events and continue to do so. And if you haven't checked out any of those, I encourage you to look into all that they're offering. During this time when it's easy to feel isolated, connecting even virtually to others can be a very positive thing for each of us. So what would we ask in closing? We would ask that our government supports flexibility in medical care by supporting the House Telehealth Caucus bill, which would protect the access to telehealth after the pandemic has resolved. We ask that people support work flexibility, whether it's telecommuting, flexible schedules, part-time schedules, asynchronous work schedules, and childcare is incredibly important for women in midlife, many of whom do have children that they need to care for, and for many women, elder care as well, as many women also do provide care for senior family members and other members in the community. So those are important things to think about. To support women, we need to really give them the tools they need to succeed. And we would also like to talk about supporting disability reform. It can be incredibly challenging, and currently, frankly, the system is not set up for someone with migraine to access disability in the same way that someone with another kind of health condition is. And so some major disability reform needs to happen to create a more fair and equitable system for people with migraine. And finally, we would ask that the government increase NIH funding and support for research. Migraine research is essential to all of the progress that we can make. Currently, migraine is incredibly underfunded considering how prevalent 1 billion people, 40 million Americans, and the fact that it is considered by the World Health Organization the most debilitating disease on the planet during midlife, and it's very underfunded considering that heavy burden. So we ask that those who have the power to make these decisions, please consider our requests. And for all of us, lend your voice, reach out to your elected government officials, join in patient advocacies. Your actions, whether big or small, can make a difference. And working together, we can all weather this storm together, not only during the pandemic, but also to improve lives for people living with migraine post-pandemic. In essence, women, we know, are essential to the fabric of our society. Women care for, support, and provide important both work and academic roles in our society. And we need to support women with migraine because supporting them helps our entire society. Thank you very much.